So my next question for you is, as you've been doing this research and having PTs be functioning in this role, have you noticed any adverse events or any PTs who are missing things? Because I think that's a concern sometimes our physician partners have, is that this is the emergency room. So what have you found?
We've done a few concordance studies looking, and we did show that in terms of the diagnostic ability and the way that physiotherapists diagnose patients, they're highly concordant to MSK specialists. Usually, physiotherapists are the best healthcare provider compared to MSK specialists in terms of their ability to accurately diagnose MSK disorders.
Hi, I'm Dr. Rebecca Griffith, the ED-DPT, and welcome back to another episode of In the ED Now, a podcast that makes you an exceptional physical therapist in the emergency department. Today on this episode, we have with us Dr. Francois Demeule, a Canadian physical therapist and researcher who's done extensive work in the area of emergency department physical therapist practice. He's going to talk to you a little bit about what it means to be an advanced practice provider in the ED, as well as comparisons between physical therapists and other musculoskeletal experts in the field of differential diagnosis and patient management in this setting. Don't miss this discussion on the future of ED-PT practice. All right, hi everybody, welcome to the show. You're in the ED Now, and I'm really happy to have here with me today Dr. Francois Demeule. Welcome to the show. How are you?
Well, thanks for having me. I'm doing good. How about you?
Great. Can you tell us a little bit about yourself, and then really, how did you get into emergency PT research? Because I think that's what everybody really wants to know.
As some of you might know, I'm based in Canada. I'm in Montreal, so I'm trained as a physiotherapist, and I've been a physiotherapist for the last almost 25 years. And I've been doing research quite a bit on MSK problems and looking at efficacy of different types of treatments for MSK disorder. And then at some point, I was interested into new roles for physiotherapists, and I've been actively working and collaborating with people across the world in terms of looking at the use of physiotherapists in more autonomous role, what we often call advanced practice physiotherapy, and that includes also using physiotherapists in advanced practice roles in the emergency department, because that's a big part of I see as where the profession can grow in terms of improving access to care and moving physiotherapists, as you would call them, full autonomous primary care providers for our populations. Yeah, so that's pretty much my background. I did a master in physiotherapy, and now I did afterwards a PhD in epidemiology and health service research. Did my postdoc on advanced practice also. So yeah, that's pretty much where I come from.
That's awesome. So I've been hearing with a lot of podcast interviews recently, everyone's talking about PTs as primary care providers, as advanced practice providers. What is your definition of an advanced practice physiotherapist?
So there's a few definitions internationally in terms of what we call about advanced practice, and if people want to read the full definition, I would recommend that they go and see on the World Physiotherapy website. There's a definition there. It's a very broad definition. I actually participated in the creation of this definition. But what we call about advanced practice roles is usually roles where advanced practice physiotherapists are positioned in a new model of care, and often it implies a new role that substitutes a traditional role that was previously done by a physician. And so they'll be providing care within their scope of practice, which is physiotherapy, but often they'll extend that scope of practice, and they'll also have for example, medical delegated acts that usually would have been, traditionally performed by physician, right? So that's pretty much how a simpler way of saying what advanced practice physiotherapy is. Yeah. So.
That's awesome. Do you think somebody has to be an advanced practice physiotherapist to practice in the emergency department? Because I think you have the research to back it up, right?
Well, I mean, obviously there are physiotherapists who are not defined as advanced practice physiotherapists working in the emergency department, and I think that's fine. I think that physiotherapy has a very strong role to play within an emergency department. If you're positioning physiotherapists within the emergency department as primary contact provider within the ED, I think there's added responsibilities and risk in being a more autonomous provider, especially in the emergency department, and that falls within the scope of advanced practice physiotherapists. How you acquire the competencies to be to have this APP role, depending on the settings and countries, is might be quite different, and sometimes that those competencies can be just acquired through experience and just training across your professional life. But in other settings, you'll see the advanced practice roles will be recognized and standardized, and there'll be like a recognized title, and also the training will be standardized also. So we see across the world, we see very different ways to become APPs within the emergency department, for example. Yeah.
So, with your research in the emergency department, what have your findings been? I mean, you've done a lot of work in this area. So, what do you think are the most important things for people to know based on what work you've done?
Well, if you go across the world and you look at advanced practice physiotherapy in the emergency department, so one of the first things that we see in a lot of countries is the fact that a lot of people with MSK disorders do show up in emergency departments. So in itself, having physiotherapists within the emergency department is quite logical. Depending on this on the countries, you'll see like between 30 to 40% of patient with MSK disorder presenting to the emergency department. So that's a lot of patient, right? And what we also see, and I'm not doing any physician bashing here, but we do know in Canada and in the States and Ireland and UK and Australia that physicians are not necessarily, fully trained to take on, in a very efficient way, minor MSK disorders. So they'll they'll assess the patient, they'll make sure that there's no fracture and the patient overall health is fine, and they'll send the patient back home. But these patients with MSK disorder, even though they're minor MSK disorders, we know that they need more than that to be efficiently cared for. And that's why I think physio have such a great role to play into an emergency department, because they're highly trained professional that can, assess adequately and treat in a very efficient way these MSK disorders. And overall, if you look at the evidence, and we're not talking about just in the emergency department, but we know that overall healthcare system and the way that we treat patients with MSK disorder at this time is not very good.
Hmm.
And if you compare the competencies of physiotherapists to other healthcare providers in the primary contact roles, they have the basic training to do a very good job in terms of treating these sort of patients. So we've been looking extensively at the competencies of physiotherapists and the way that they can, actually treat very efficiently patient in the emergency department. And there are great benefits of having a physiotherapist in the emergency department in advanced practice roles. Obviously, the first one is that across the globe, emergency departments are usually overcrowded, so wait times are a big issue, and they're understaffed, and physicians are the burden for physicians is important. So having another resource, adding resources to treat specifically minor MSK disorders with physiotherapists does increase access to care. So that's pretty much I mean, it's been the main driver to that promoted the implementation of advanced practice physiotherapy in all settings, not only emergency department, but in primary care and in specialized care, either orthopedic, rheumatology, or physical medicine, we implemented advanced practice roles because we wanted to increase access to care. But after doing that for many decades now in certain countries, what we see is the fact that these models of care do increase access to care, and that's what we wanted. But they also have many more benefits, and that includes, overall increasing, the better outcomes for patient in terms of pain and reduction of disability, and also satisfaction with care, and also if in terms of the efficiency of care, we see that physiotherapists uh, resource use, such as imaging and use of medical prescription and stuff like that, are usually reduced when we're using advanced practice physiotherapists in these models, and that includes also in the emergency department. Yeah.
I think that is a big concern that a lot of people have. And when you talk about efficiency of care and access to care, those are definitely issues that we also have in the United States, obviously, maybe for different reasons. But access to care has been a huge issue. But a lot of people that are trying to implement their practice in the emergency department get this pushback like, you're going to make everything slow down. You're going to decrease our ability to get patients through the ED. It takes too long. We don't have time for that. So you're saying physical therapists really are a more efficient way to use care, even if it might not seem that way.
Well, there's two things to that. So, I mean, we want to treat these patients, in a more in an efficient manner, so that we can take care of their pain and their disability, and we want to increase access to care. And the way that physiotherapists do that is a bit different from what we usually see going on in emergency department, like consultation with a physician. If you're showing up with a minor MSK disorder, is going to be quite short usually, and that's fine. They're overburdened. The healthcare system is set up that way. I'm not throwing rocks at physicians. That's how things have been.
Yes.
But using physiotherapists, because of their competencies and because we're designing the new models of care with physiotherapists, and we give them a bit more time to assess these patients, because we know that we need a bit more time to fully assess them properly, and to also give them education and give them reassurance and give them proper exercise prescription. And we know that these items in terms of patient care for MSK disorder are important. They're evidence-based. So we need to reassure patient with their minor MSK disorder. We need to give them good education in terms of how to manage their pain, and we need to give them exercise. So there's two components to the fact that we're using physiotherapists in advanced practice roles. Like, yes, they are competent and they've got the skills to treat these patient efficiently. But when we're using physiotherapists, we're also changing the model of care. We're giving a new healthcare provider within the emergency department, a setup where he has time to fully assess and fully treat these patients in a more efficient way. And we've got a bit of data to support this in terms of, we see that patient outcomes are better. And for example, we've got some pilot data here in Montreal and Quebec where, once we do that and we treat patient in a more efficient way, in a more evidence-based way, that patient will represent less often to the emergency department with their initial complaint, because, all their needs have been, more fully assessed in the first time that they showed up to the emergency department. And that's a big thing, right? So we got a bit of statistics that showed like a great reduction in terms of representation, and we're actually doing like a large RCT right now, and our hypothesis is that we're going to be showing this once again, that using APPs in emergency department will reduce significantly, representation to the emergency department for the same complaint.
Well, for those of you listening who are trying to start your practice in the emergency department, representation, recidivism, bounce back, those are all kind of the same concept. And especially in the United States, that's a huge metric that hospitals are measured on, is how often patients are coming back for the same complaint. And our
Interesting.
unpublished data kind of is similar to what you found. We found that patients were like, I think maybe 20% less likely to come back for any reason if they saw a physical therapist, but were 50% less likely to come back for the same reason if they saw a physical therapist. So if they came in for low back pain, they were 50% less likely to come back for low back pain. So I think I'm optimistic that your data is going to look good on that, because I think it is a huge thing that we do. So many times I'll have patients who maybe have come to the ED 6-7 times, but didn't see a PT for whatever reason. Either we weren't there, or the physician didn't order it, or they got missed somehow. And the revisits kind of stop after that point, partly because they get that hands-on care, they get that education, but they also get a plan, like a plan of what to do next. That doesn't just include taking medication or sitting on the couch at home. We get them set up with a physical therapist, with their primary care doctor. We get them on to specialty clinics as they need. So I think that's another big role that we can play in that area too. So my next question for you is, as you've been doing this research and having PTs be functioning in this role, have you noticed any adverse events or any PTs who are missing things? Because I think that's a concern sometimes our physician partners have, is that this is the emergency room. This isn't just a clinic. Like, you need to know what you're looking for, and you need to not hurt anybody, and you better not miss anything. So what have you found?
So, so there. I mean, we've done a few concordance studies looking, and we did show that, in terms of the diagnostic ability and the way that physiotherapists diagnose patient, they're highly concordant to MSK specialists. So overall, there's quite a few studies done on that, where we're comparing, the concordance, the diagnostic accuracy of physiotherapists compared to MSK specialists, and the data is quite compelling. Usually physiotherapists are, the best healthcare provider compared to MSK specialists in terms of, their ability to accurately diagnose MSK disorder. So that's one thing. But at the same time, there's not a lot of data, of large cohort studies, where you're going to be able to have like a significant number of red flag patients within these cohort studies, where you can see that the ability of physiotherapists is comparable to physicians or MSK specialists. So there's not a lot of data on that. I'm confident that physiotherapists do a pretty good job in terms of picking up the red flags, but the overall evidence is not that not that conclusive in terms of that, because we're lacking large numbers of patients being assessed, and being enrolled in cohort studies where we can really, be specific about this. There's actually probably just one Australian study. It's a retrospective study, but it wasn't in the emergency department, but it was for MSKs. It was for various MSK disorder, including, and it was overall allied health professionals, being in advanced practice role in different settings, including orthopedics and rheumatology and stuff like that. But also OTs were also included in these advanced practice role. They had about 10,000 patients within these specialized clinic, where advanced practice professionals were practicing and were seeing patient in place of physicians. And they did not see any increase in terms of adverse events happening, because patients were first seen by these advanced practice practitioners. So there's this one study that did show that, that usually if healthcare professional in advanced practice roles, including physiotherapists, if they're trained well, they seem to be doing as good as physicians. So that's sort of reassuring, but we're still lacking a bit of data on that in terms of that. So for sure, yeah.
I think that's also hard too, because a lot of these patients may not get follow-up, so we don't necessarily know.
No, and you're actually right, and I think the emergency, that's a big question we still need to be able to answer. And actually, the large Canadian randomized controlled trial that we're doing, we know that we've already picked up a few red flags within the trial. So I'll be curious to see the full statistics of this when we're going to be comparing physicians to physiotherapists in terms of having identified on, like a number of red flags within this trial. So so I'll keep you posted on this, on
I
these
can't
data.
wait.
So.
I think that you're going to find so many interesting things. As part of my fellowship program, I've been required to track my outcomes. And compared to my colleagues that practice in an orthopedic clinic, it's very difficult, right? Like I see a patient one time, like what outcomes are there? So it's been interesting. And one thing that I've been doing as part of that is like going back into these charts and looking at what happened over the next 10 days after I saw that patient.
Yeah.
Did they come back to the ED? Did they make their follow-up appointment? Did they have, like what other things occurred to that patient? And it's been very interesting to me to see some patients do follow up with outpatient clinic, and I can see kind of how their trajectory goes. I had one patient who actually passed away within the next 10 days after I saw them. So I think that's the other thing, that in this setting specifically, we just often don't really know what happens to our patients. And that makes it kind of a unique practice setting, in that we don't have that long plan of care. We don't know how to measure our effectiveness really over time.
Yeah. So yeah, it is certainly the role of that practice physiotherapists and physiotherapist emergency department is a bit different from what we usually do in traditional physiotherapy, for sure. So because we're not necessarily following up on these patients, but as part of the trial, we're going to be recruiting almost 700 patients, over 700 patients into this trial, and all patients with minor MSK disorders, and we're following them up to 6 months. And our hypothesis is that, overall after 6 months, the outcomes in terms of pain disability will probably be pretty much similar between the physician-led care and compared to the APP arm of the trial. But we feel that within the first 3 months, the outcomes of patients should be better with APP care than compared to usual physician-led care. So I'll be very curious to see this. So but yeah, because the way emergency department physiotherapy is set up, we don't see our patient after their first episode of care within the emergency department. So that's really an issue. Yeah.
Yeah, it's definitely hard to know how you did over the long term. Maybe it's easy to know how you did in that moment.
Yeah.
But I've also had a couple of follow-ups where like I felt like I didn't really impact that patient, and then later on I found out that like changed the trajectory because they were able to get that follow-up care that they needed. My next question for you is, tell me what it looks like when a patient goes to the emergency room in Canada. So I know people in Canada absolutely know what this looks like and how this PT might fit into this, but I know it maybe looks a little different than it does in the United States.
Well, so first of all, APP, emergency department physiotherapy, is not fully implemented across Canada, right?
Okay.
So we're seeing it being rolled out quite a bit, and there's probably like a few dozen emergency department across Canada that are rolling out the advanced practice model. And the way that it is set up now, as we see, is like physiotherapists are considered autonomous primary contact providers. So there's no real problems in terms of legislation having a physiotherapist assess autonomously a patient that's coming to the emergency department. So we need to have the patient agree to this. So because it's not the usual traditional point of care, in some settings they'll tell the patient coming in, well, you fit in within what we call a minor MSK disorder, and if you're comfortable with that, we're not going to be having you see the physician right away. You're going to be able to see the physiotherapist, and you might not be seeing the physician afterwards if the physiotherapist feels that he can autonomously take care of your condition. So in most settings, that's how it's going to be done. And for most patient, for a majority of patient, they'll be assessed and treated and cared for autonomously for by the physiotherapist. So physiotherapists do have imaging prescription rights within Canada. It changes from province to provinces, but in Quebec and the province in Quebec and in Montreal, where I'm based, physiotherapists can prescribe autonomously X-rays. If they want other sort of imaging, they'll need to go back to the physician within the ED and discuss this with the emergency department. But across other provinces, physiotherapists do have autonomous imaging prescription rights, so they'll be able to do that and assess the patient. In terms of other medical delegated acts, it'll be different from provinces to provinces. Sometimes they'll be able to prescribe some medication, mostly basic analgesia and for example, oral NSAIDs, but that's not the usual thing that we see. So you usually physiotherapists will assess the patient, as a primary contact provider within the emergency department. They'll be able to order, or she'll be able to order some sort of imaging if she feels or he feels that that's required. And if he needs to offer some medical treatment to the patient, then they'll go back to the physician and discuss this with the physician, and they'll care, collaboratively with the patient, with each other to care for the patient. So that's pretty much how it works in terms of how patients are assessed within the emergency department. So, yeah.
That sounds so much more efficient and streamlined than having to involve multiple providers that might not need to have contact with the patient.
Yeah, I think, and I think there's not a lot of evidence specific to advanced practice physiotherapy for that, but there's a bit of indirect evidence in terms of patient and their care pathways and their journey within the healthcare system. Having multiple provider and having more providers sometimes is not necessarily the best way to treat patient. We see that sometimes, that you'll have conflicting uh, messages giving to the patient, and that can actually impact the outcomes of patient. And there's a bit of data supporting that in terms of MSK disorder. If we're not giving having the same information given to a patient, it brings sometimes it can impact the outcomes. And so I think that's important. Obviously, I'm all for, working and having interprofessional collaboration within providers to care for patient. But sometimes, if the condition is fairly straightforward, you don't need you don't need, two or three healthcare providers to care for that patient. And sometimes when you do that, it's not necessarily the most efficient way of doing things, and it actually can be confusing for the patient also. Yeah.
And here, I think the other elephant in the room on that is how much cost that adds to the patient with each
Yeah.
provider into the healthcare system. And when you think about the access issues that we have to care, if 3 people are seeing one patient that don't need to be, then we could be freeing up those people to see other patients. So I think that's definitely an area we need to focus.
Yeah, for sure. Yeah.
So a lot of conversation in the physical therapy profession, and I think kind of worldwide, is how is the PT profession going to be sustainable in the years to come? What are your thoughts on that? Do we need to move to that primary care model? Do we have to be advanced practice PTs? I've heard PTs say, I didn't sign up for that. I've heard other people say it's been way too long. We should have been doing this 20 years ago. What do you think?
Well, I think, yeah, I've heard PTs say this, that they're not super positive about the fact that we're moving to more autonomous roles, and making physiotherapists, a fully primary contact provider. I've seen that, and I understand, that some people might be afraid of the changes. It's more responsibility, and we
Mhm.
need to make sure that physiotherapists are adequately trained to do that. I don't think across the world that right now all physiotherapists are ready to be, primary contact provider, a safe and efficient primary contact provider. And being a primary contact autonomous provider is a bit different than direct access. There's a added, risk to being such a provider. and the competencies required to do that are greater than what we've been usually trained physiotherapists just to be part of the direct access model of care. So,
Hmm.
but I do think that that's where we want to go. I mean, at least in Canada, I mean, the way that the healthcare system for physiotherapy is set up in Canada is that we have very most physiotherapists, about 60% of physiotherapists work in private practice, right?
Mm.
And about 40% of Canadians do not have the private health insurance that would
Oh,
allow them to access private clinics. So we've got about 40% of Canadians that do not have adequate access to physiotherapy, and that's a big issue. And obviously, these 40% of Canadians that do not have access to private healthcare insurance are the ones who probably are the most in need of that sort of care, right? Because
yeah.
they're underprivileged population, lower income population. So they're usually the ones that are most in need of care because their health condition is usually poorer, and et cetera, et cetera. So yeah, so I do think that we need to move from this. We need to become primary contact provider. And that's one of the big shifts that we're seeing here, is that we're moving back physiotherapists into the public healthcare system. So that's pretty much, so emergency department is obviously where we're seeing a lot more physiotherapists, job posting appearing across Canada, but also into primary healthcare teams, right? With family physicians and family health teams. So physiotherapists are being integrated again into these groups, which 10, 15 years ago, there were very, very few physiotherapists within these family physician groups, and now we're seeing more and more physiotherapists being there. So if they're into these groups, it means that they can, see patients, that did not have access to physiotherapy before. So I think I feel that's something that's very important for the profession, that we can be professional, that can offer care to the entire population of our country. And I think it's a bit different in the States, but I think there's still similarities between what's happening in Canada or elsewhere in other publicly funded healthcare systems and the States, right?
I think you're absolutely right. And I think no matter where we are, we need to grow and move and change and get to where our patients are, because I mean, I say this all the time. I'm like a broken record, but physical therapy shouldn't be a luxury. It should be a basic healthcare
For
service that's
sure.
provided to people, regardless of their ability to pay. But I think that opens up a whole nother can of worms. So thank you so much for your time today. I really learned a lot. And I have one more question for you. Like, what do you want to leave people with? Like, what are your parting thoughts you want people to take away?
Uh, what are my what should I say? As I think, well, I think we need to see physiotherapists, as you say. It's not a luxury. It's something that's important for patient. And if you look at the evidence now, 20 years ago, we would say, oh, well, you might try physiotherapy, it might help you out. And if you look at physiotherapy 20 years today now, it's part of what we considered evidence-based care for a whole bunch of disorder, not just MSK disorder. And
Mm-hmm.
we're now, key providers and for a whole bunch of healthcare problems. And so we need to take our place, and we need our profession to be very positive, and to advocate for this, and to make sure that we are working with physicians collaboratively, but we need probably to go beyond that and to be, as I said, full primary contact provider with more autonomy, for sure. Yeah.
I love it. Thank you so much for being with us. You're in the ED now and you're officially discharged.
Thank you. Thanks for having me.
Thank you so much. Have a great day. Thank you for listening. In the ED Now is a podcast hosted and produced by Rebecca Griffith, the ED DPT, as part of Rebecca Griffith Physical Therapy, LLC. Our podcast makes you an excellent emergency department physical therapist. This podcast is intended for educational use only and is not intended as clinical or medical advice. While we make every effort for accuracy, factual errors may be present. Since you've been in the ED, I'm prepared to give you your discharge instructions. Please subscribe, share, and find more at the eddpt.com. You're officially discharged.